Imagine trying to deliver a newborn baby in the dark or in the fumes of a gas generator. This is the reality for most rural health centers in developing countries. The Ihangane project and Catapult Design are working with the Nyange Health Center in Northern Rwanda to rectify the situation in their community by establishing a reliable system of solar electricity at their site. In August of 2009, Dr. Wendy Leonard of the Ihangane Project and Heather Fleming of Catapult Design joined the maintenance director of Ruli District Hospital, Jacqueline Umubiehi, to perform a first-hand assessment of the health center's needs. Nyange is over 30 kilometers from Ruli District Hospital in the northern province of Rwanda. Due to the remote location, treacherous roads, and variable weather, the health center is often the only resource for medical care. The majority of people depend on foot or bicycle travel, and hospital vehicles are often the source of much-needed supplies. So we packed the hospital ambulance and made our way to Nyange. Nyange Health Center has maternity, adult and pediatric wards, isolation rooms for tuberculosis patients, as well as HIV counseling, testing, and treatment services. They have a small solar electrical system that was installed over 10 years ago, but it is inadequate to provide even the basic needs such as consistent lighting and radio communication. The nursing director of Nyange Health Center initially proposed an upgraded solar system, and Catapult Design and the Ihangane project met with the health center staff to better understand their work and their electrical needs. Nyange Health Center delivers between 25 and 50 babies per month. According to Dr. Ngira, the medical director at Ruli District Hospital, there is a cultural belief that labor for delivery begins at night. Most women will not go to the health center until nightfall due to this cultural belief. Without electricity, the nurses who run the health centers are placed in positions that can be dangerous for patients or even for themselves. It can be difficult to assess if a newborn baby is in distress without light. It can also be difficult to protect healthcare providers from exposure to infectious body fluids when they are unable to adequately assess the patient and their environment. Sadly, many women and newborns have died simply because the health center could not radio the hospital for an ambulance when the electricity had failed. The laboratory technician makes the best with the equipment she has. The donated microscope is used without electricity because their current system does not have an adequate DC to AC inverter for the equipment. Laboratory samples are manually agitated and centrifuged, and equipment sterilization is performed with a propane-fueled autoclave.
noneho ufite ya noneho ya indi elegitike byose yabikora yaba amaraso yaba n'ibyo ngibyo
oya.
With the information gathered from our needs assessment, we have obtained bids from various solar vendors. Based on recommendations from the engineers at Catapult Design, the Ihangane project will choose a vendor based on quality and cost effectiveness. Once the system is in place, the Ihangane project will collaborate with Solar Electric Light Fund to establish a monitoring and evaluation plan that ensures longevity of the electrical system for years to come. When compared to its 5 East African neighbors, Rwanda has the highest maternal death rate and is tied with the Congo for the highest infant mortality rate. Reliable electricity is not a luxury but a necessity. Rwandans are working hard to change these statistics and provide a bright future for their children. Please join us in supporting their efforts.